Good morning, everyone. This is Dr. Sonia McGowan with Covenant Pediatric Wellness Center, and I am with you today to talk about bioresonance testing. So let's give people just another minute to get in and get settled, and we're going to get started. So bioenergetic testing is amazing. And in fact, I am releasing a podcast, I think maybe next month, with Samantha Stupak, who is the founder of Creating Balanced Health, which is the lab that I use for the bioenergetic testing. So I'm pretty excited for both of these topics. So if any of you are new here and you don't know me, again, my name is Dr. Sonia. I am the owner of Covenant Chiropractic and Wellness, as well as Covenant Pediatrics. We're a multi-specialty clinic here in Jefferson City. I am married to Shannon, who is the love of my life. He is a CPA, and we live, of course, in Jefferson City. We have a newly empty nest. So our daughter, Libby, is done with school and college, and she's got a big girl job as a music director at School of Rock in Kansas City. And so we also have Rowan, who is 18. He is now kind of wrapping up his first semester at Millikan University in Decatur, Illinois, as a theater major. And Rowan is really the reason why my practice is the way it is today, because when he was a little guy, he had some pretty significant challenges in terms of behavior, language development, sensory seeking, sensory avoidance behaviors. And I really consider him my first recovery story, because we literally went everywhere and got very little help. And so once we healed his gut and changed his diet and implemented some biomedical strategies, he is right as rain. So we're pretty proud of him. And then, of course, this is our Lola. She was our English bulldog who went to heaven just a few months ago, and I still can't bear to take her off the slide. So, all right. So a little bit more about our practice. So we do lots of things here. We really do specialize in what I call complex kids. So this can be, kids with autism, PANS pandas, ARFID, PFAPA, kids with ADD or ADHD. We don't really treat the letters, right? I don't care what you call it. What we're trying to do is get to the root of exactly why they're having whatever behavior, language, socialization challenges that they might be having. And to do that, we use a lot of functional nutrition. We use brain-based chiropractic, craniosacral therapy. We also do a great deal of work in our Spot for Tots program around oral restrictions. So lip, tongue, and cheek ties are a really big deal. We're seeing more and more of those. And so we do very comprehensive evaluation and intervention for those oral restrictions. We also have an early beginnings program where we work with expectant moms and new babies. And then we also do things like HBOT, ion cleanse, nutrition testing, functional medicine testing, just for typical folks as well. And then Covenant Pediatrics is actually our pediatrician, Dr. Hannah Strong. She joined us in January and is going strong with her pediatrics practice. So for anyone in the area who needs a pediatrician who is flexible and easy to get along with and will not dismiss you based on your strongly held beliefs about certain things, we are definitely the practice for you. So in everything we do, we're always trying to get to the why of a child's challenges. We know that the why matters. And until you figure out exactly what is promoting the challenges that child has, you're really just putting a Band-Aid on the problem. You're not getting to the root cause of what's happening. It's just like, putting a piece of tape over your check engine light, right? Generally, challenges that kids have are not a Miralax deficiency. They're not an Adderall deficiency or a Ritalin deficiency, right? We've got to get to the root cause of exactly why that child is struggling. And I think that is why we have such great success and such fantastic outcomes for kids, because this is our goal and our target at all times with every child. So let's talk about bioenergetic testing. You know what? I should have told you, if you have questions, to please drop them in the chat box. So there is definitely a couple of ways that you can leave your questions. So there's a chat and there's a Q&A box. I really do prefer the Q&A box. It's easier for me to see. So as I'm able to, I will answer your questions as you have them. All right, so bioenergetic testing, you may hear it also referred to as bioresonance testing. And so this is a way in which we take hair and saliva samples. We can also use nail clippings. And through their magic in the lab, they're able to measure the vibration of, or the energy around those particular samples. And so it will tell us many, many things. So the report that you would get on a bioresonance full scan is about 7 or 8 pages long. And I will show you a sample as we get through here so you know what we're talking about. So it will rate each of the body systems and how much stress, it will tell us how much stress that system is under. So, if it's an immune system problem, if it's a skin problem, we will generally see this reflected as a higher amount of stress on this particular page of the results. What I really, really love about this test is that it gives food and environmental sensitivities. Allergies always require blood, but sensitivities we can do as a bioresonance or bioenergetic scan. And so this particular test will scan the specimens against literally hundreds of foods, food additives as well. So things like preservative, dyes, all are scanned as well. And then hundreds and hundreds of environmental sensitivities. So chlorine or bleach or detergent or soap or chimney smoke or you name it, mold, for example. All of those things are environmental factors that many of our kids are sensitive to, but it is very challenging to test those things. It's also really hard because with sensitivities, it can take up to 3 days after an exposure to show a response. And so in cases like that, it's very difficult to make a one-to-one, correlation because the amount of time is so great. So it's really fantastic that this is a component of the actual full scan that we do, because many times there are things at play, whether it's food dyes, food additives, or environmental issues that are promoting behavior. And so it's really important for us to know that so that parents can take the appropriate steps to, change diet, change environment, etc. This test also tells us about hormones. So if something is high or low, it will tell us, as well as nutrient deficiency. So it's going to tell us about vitamin levels, minerals, omega-3s. It's also going to tell us about digestive enzymes. So again, it's quite comprehensive, which is another reason why I love it so much. It will also tell us about toxins and pathogens. So it will list out any viruses, bacteria, parasites, any sort of yeast or fungi, metals, and chemicals that could be promoting some of the challenges that the child may be experiencing. Or adults. We do this on adults as well. And then this is a phenomenal part of this test as well. The lab will scan the specimens that we send in, the hair, saliva, nail clippings, against potential remedies. So what basically is generated is a protocol of either supplements, homeopathics, or herbs that will address the most pressing issues. And so there's really, it really kind of takes the guesswork away from what that particular patient needs. So let's look at a sample report. So this is page 1. This is the organ system stress that I was telling you about. So it's probably hard for you to read, but these dials are a way to quantify how well that organ system is doing. So for example, this is the integumentary system, which means skin. And this is the key. So if it is green, it means all is well. Okay, so very little stress that organ system is under. as we move into yellow, orange, red, and dark red, those are telling us that that particular organ system is under more stress. So, for example, this is the nervous system, and it is yellow, so it is under a minor amount of stress. This particular patient only has green and yellow, so they're actually in pretty good shape. There are some patients who, may under liver gallbladder, for example, have, just really chronic, significant stress. And so that helps us really know exactly what that patient needs. Also on page 1, it gives us some notes about the most significantly stressed individual organs. So for this patient, their most significantly stressed organs are their adrenal glands, their large intestine, and cellular metabolism. So I read cellular metabolism as a big part of mitochondrial function. And I've done webinars in the past about this, the body's ability to take the food and turn it into energy inside the cell. This is generally something that is quite impaired in most complex kids. So when this comes up, it's a major red flag for me, and it really guides our intervention process. And then as we come on down, we get some additional information about the most significantly stressed points and parts of the body that need even more support. So for this particular patient, it was the central and peripheral nervous system. In that case, my first recommendation is going to be get adjusted by a qualified chiropractor. If it's a kid, make sure it's a pediatric chiropractor. But the nervous system controls everything. And so getting adjusted is the best way to influence that. And then we see stomach, lymphatic drainage, hypothalamus, thyroid, and thymus. So the hypothalamus is a gland in the brain that is a major controller of things like body temperature, sweating, appetite, sleep-wake cycles, etc. And you'll not ever really see this in the literature, but what I know clinically from all my work with complex kids is that the hypothalamus is generally under a lot of stress in most of these kids. And when we support hypothalamic function, we generally see some improvement in kids. The thymus is an immune system gland. It sits behind the breastbone, and it's very active as a child. It becomes less active as we get older. And, most kids with complex needs, particularly autism and pandas, tend to have pretty significant immune system dysfunction. So this is an area where we see dysfunction pretty consistently. All right, and so page 2, here we go with those sensitivities that I talked about. So this particular patient has a lot of environmental sensitivities. So you can see we have cleaning supplies and detergents. We have EMFs, which are electromagnetic fields. So think, Wi-Fi, cell phones, things like that. Many of our kids are exquisitely sensitive to this. And, when they have a lot of exposure, they tend to, be under more stress, and, it affects behavior, language, communication, etc. This person also has hairspray and lawn chemicals. So you can see, it's every patient is different, right? And for this particular patient, their major concerns are environmental things. We also see that they have some sensitivity to legumes. So soy, so it comes back as soy, bean, and tofu. And then, of course, under dairy alternatives, we see the soy milk. And then for fruits, we see that they have a sensitivity to oranges. And then continuing on page 2, you can see all the different headings here. So we have grains and dairy, we have shellfish and spices and fish and additives and ingredients and, vegetables, fruits, nuts, all of those things. So this test is very, very comprehensive when it comes to food and environmental sensitivities. All right, now this is the page that tells us about the nutritional imbalances. So here we see amino acids, enzymes, and fatty acids. And so this particular person, for example, is low in amylase, which is the enzyme that's in our saliva that helps us start to break down carbohydrates, lipase, which is what breaks down fats, and then pepsin, which is one of the major enzymes in your stomach. So, this would be a pretty significant finding for me, right? Because if this patient can't digest their food early in the process, then later in the process isn't going to be great either. So that's something that we would want to intervene with. And then here we have the minerals and the vitamins as well. So this patient has iron, potassium, and zinc deficiencies, as well as some issues around vitamins, choline, niacinamide, and vitamin B5. Here is the toxins section. Now, what you're going to see here is we have parasites, we have molds, sorry, I need my peepers, bacteria, oh, not molds, metals. Sorry about that. My eyes are getting old. So, but what you'll see here is just a description of each of those toxins, not an actual name. The FDA has pretty specific standards about, what you can and can't say on diagnostic reports. And so this particular patient has 3 different parasites. Nothing to freak out about. We all have parasites, but for some kids, it's a big deal, depending on what they are and their body's ability to cope with that. But you'll see, you can get some information about each one of these based on the description. We have our metals here and bacteria. And then we have mold, viruses, and chemicals. So again, it just gives us information about, what sort of toxins or pathogens are present. Those can be very depleting to the system, very difficult for the immune system to deal with, as well as the detox system as well. And then here we have hormone imbalances. So this particular person has low calcitonin, low cortisol, low T3 hormone, thyroid hormone, and then low testosterone. And so you can see that the report gives you a description of each one of these things. And then finally, we get to the remedies section. So the report will break it down and categorize it by herbs, homeopathics, and supplements. So this particular person scanned as needing something called burdock intrinsic. And so the dosages are given right here, and then a description of exactly what burdock is good for. And so this was scanned and found to be an important remedy for this person early on in the game. And then we see more remedies come up here. So we've got, looks like Trifolo intrinsic. Both of those, the first 2 are herbs. We also have now homeopathics, inflammatox, so working with some inflammation. And so we can be very specific when we send these specimens to the lab. We can ask the lab to give liquid remedies only, or to give homeopathic remedies only. Herbs generally are pretty strong tasting, and so that can be difficult for little ones to tolerate. The homeopathics are much more easily palatable. And so if this is a pregnant patient, for example, we can put that and ask the lab to scan for only remedies that are safe for pregnancy or breastfeeding, for example. So we can be specific when we need to. We can ask for no capsules, etc. So this test is a great option for kids, especially who can't manage a urine sample, a stool sample, or a blood test. We have lots and lots of kids who really struggle giving samples like that. Blood draws can be scary. Sometimes, kids have behaviors that just won't allow them to cope with urinating in a cup, for example. Or you've heard of they call them hats that you put in the toilet to capture stool or urine. There are some kids who just can't tolerate something different like that. Or kids in a diaper, and we just can't manage the collection kits. And so this is just a really nice alternative option, because really anybody can give saliva or hair or nail clippings. It's also really good for patients who have very deep-seated issues. So patients who are particularly complex, who we just know, we've done blood work, we've done other more mainstream tests, and we're just feeling like there's still something going on. This is a really, really good test, because it seems to unearth issues that more traditional types of testing just can't seem to get to. And it is very comprehensive. So it's really the only test I've seen that gives all of the nutritional information as well as the food and environmental sensitivity information. And, you can do separate tests for those, totally fine. That tends to increase the cost, of course. And most food sensitivity tests don't also include environmental things. So you have to do two separate sensitivity panels. And the number of foods that are tested tend to be, pretty short. And in this case, it's hundreds of foods and environmental toxins. So I really love that it gives a large amount of data for a modest price. So you're really getting a lot of bang for your buck here. And again, it's a nice option if we suspect environmental sensitivities as well. All right, so there are various panel options for the bioresonance testing. So what I showed you was a full scan. So it's hair, saliva, nail clippings, and it gives all 7 or 8 pages of that particular data. If we don't need that much data and all we want, for example, are the food and environmental sensitivities, we can do just that. So we just mark on the requisition. That's all we want. It's the same submission of hair and saliva, nail clippings if needed. And we can also do just a remedy scan. So many times what I'll do is the first time out, we order a full scan, which is what I shared with you. And we do the remedies, patient improves. Now we want to get new remedies, but we don't necessarily want to do the entire scan again. We can do what's called just a remedy scan. And that gives those last 2 pages only. It only scans and gives us results for the exact remedies that are needed. It's brief. Therefore it's less expensive. And so it gives us a little more longevity. And then at some point when the time's right, we can repeat the full scan and kind of compare apples and apples and kind of see what kind of progress has been made. And we can move along in that process, which is really effective for many patients. I really like that there's no guessing about the protocol. So it's scanned, it's specific to that patient. And so it's just great because it's easy and it's individualized to them. The one more thing I really like about this is that there's no age limit. So for many other tests, it's, for example, we talked about the metabolomics in a previous webinar. You have to be 2 years old to send samples for that. And so that can limit, especially when you've got, kids younger than 2 who've got some significant issues. They really need intervention. This is a good option for them because the collection is easy. There's no age limit. So that is very helpful. And so in terms of price, the full scan, like I showed you, is $3.99. The remedy scan is $129. So that's, again, the test that only gives the remedies. And then the sensitivity scan, which gives the food and environmental sensitivities, is $179. Again, they all only require the hair, saliva, and or nail clippings. We can also kind of be a little creative too. For example, we had a baby in the clinic this week who didn't have enough hair to give a sample. So we just did double saliva samples, and that works just fine. Mom had just clipped nails, and so their nail clippings weren't an option. So we just did 2 saliva samples, and that works perfectly fine. So again, to summarize, each of the components on this test gives valuable insights into the state of the child or the patient's overall health. It can really guide your healthcare professional in developing a personalized intervention plan for kids with autism, other complex issues, and just regular folks too. I've got, adults who come to me all the time, with hormone issues or, mood dysregulation, things like that. And they just know that they want to take a more holistic approach, really figuring out the actual reason for those symptoms. But remember, interpreting these components needs to be done by someone who's experienced, who has the right credentials and experience in functional nutrition, complex kids, etc. So as a reminder, the why matters, right? You don't want to put Band-Aids on anything. You don't want to put tape over your check engine light. You want to get to the actual problem, fix that problem, and then you fix the problem, right? And so we do that by being very specific about, doing the right labs, doing them at the right times, at the right pace, and really just always having our eye on the prize of we're looking for the why behind complex kids' behavior. So if you're interested, we are always taking new patients. We're busy. We do have a bit of a waiting list, but I will never turn patients away. So if you're interested in, if you're an existing patient and you need a follow-up, if you want to become a patient, you're more than welcome to call and get scheduled. Sometimes, it depends on the patient, what lab I will recommend. Sometimes I recommend the bioresonance testing. Sometimes I recommend something else. It really just depends on the patient, their history, their exam findings, etc. So if you're interested in this particular test, we can always definitely talk about it and see if it's right for you or for your child. So there's the contact information. We're here in Jefferson City. We also do telehealth visits. We have multiple staff who would be eager to help you. If you have specific questions for me, you can always email me, Dr. Sonia at covenantwellness.net. If you're interested in scheduling an appointment, the best way to do that is to get with my scheduling coordinator. Her name is Brittany, and her email address is Brittany at covenantwellness.net, and she will start the process with you. So that's all I have for you this morning. Any questions before I let you guys get back to your day? If you have questions, just drop those in the Q&A box for me. Just a reminder, for next month, we are in December doing a webinar on PANS and PANDAS. And I think it's generally the first Friday. So watch social media. We'll put all the information out about that. But we'll be talking in more depth about PANS and PANDAS. And so if you know someone who, is new to that diagnosis, if you yourself, need more information about that, if you know someone who, child is really struggling and you think this could be a possibility, definitely direct them to our social media so that they can register. And as always, for anyone who registers for the webinar, they will automatically get a link to the replay. So if you can't attend the live event, you can definitely then just watch the replay. We always put copies of the webinars on our website at thewhymatters.net. You can also find our podcast there as well. So this month we are, in fact, today, I think we're dropping an episode about auditory processing disorder. I interviewed the audiologist who is the director of the Able Kids Foundation in Fort Collins, Colorado. So very interesting episode. So if you have a child who has any kind of auditory processing issues, that would be a really good episode for you to listen to. But we have almost a year's worth of podcast episodes that you might find valuable as well if you have complex kids. So you guys have a great holiday coming up, and we will see you for the December webinar on PANDAS. Have a great day, guys. Thank you.